Hello, I'm Andrew Mull, Advocacy Director for AARP in Louisiana. We're here today to answer your questions about your Social Security. AARP knows that you work hard and pay into Social Security, so it's only fair for you to expect to get the money you've earned. We know Social Security can be confusing, so we are here today to offer our expertise on any questions you may have. This tele this telephone town hall is hosted by AARP Louisiana, and I'm pleased to welcome our special guest, Maria Alvarez, bilingual public affairs specialist, the Social Security Administration in Louisiana. Again, I want to thank you for joining us today for an information session to help you understand the Social Security you've earned and the challenges facing the program long term. AARP has been fighting to ensure Americans get the Social Security they've earned for decades. And we can answer some of your tough questions that should help you get when you want to claim your Social Security. Some questions we hear often and can answer today, like when should you claim? How can you maximize your money? How much will you get? What kind of long-term challenges does Social Security face? Again, this is an interactive event, and this is your chance to hear from and ask questions of Maria, who, like I mentioned earlier, is with the Social Security Administration here in Louisiana. If you would like to ask her a question at any time during the call, just press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in the queue. The sooner you press *3, the sooner you'll be on the line with our guests. Now that you've received some background information, let's jump into the discussion with our expert. And as you are all thinking questions, I'll go ahead and introduce her. Maria Alvarez is the Public Affairs Specialist for the Social Security Administration in Louisiana. She's worked with the agency for over 30 years. In her current role, she's responsible for all aspects of Social Security public information and education in Louisiana and East Texas. She serves as the primary media contact for Social Security in that service area and represents the Social Security Administration at community events. She also conducts presentations on Social Security's retirement and the disability programs and works in partnership with aging, disability advocates, and stakeholders. Thanks again for joining us, Maria. The floor is yours.
Thank you, Andrew, and thank you to AARP Louisiana for inviting me to join your town hall meeting this morning. It's absolutely my pleasure to be with you to answer your questions and basically offer some insight about what you need to know about Social Security retirement benefits. SSA or Social Security Administration does extensive outreach and education about a retirement program, basically so that you, near retirees, can make informed decisions about your retirement. So today, that's what we're going to accomplish. I would like to add that the information given today is general information, which applies to most recipients. However, there may be factors unique to a person's situation which may differ from the norm. So that's why when you file for benefits, we will ask in-depth questions to make sure that all of those factors unique to one's circumstances are evaluated and that corresponding policy is applied so that you get the benefits that you're due. Andrew?
Well, right now, Maria, we have people calling in, and our queue is filling up with questions that a lot of our folks want to ask. But while they're still queuing up, I want to ask one question, I guess, to really kind of start the conversation. What is one of the biggest myths or one of the things that most people get crossed up by or confused about when it comes to Social Security?
Absolutely. Actually, I think there are two assumptions that I hear the most from workers, and they happen to go hand in hand because they have to do with how much a recipient might be able to draw in retirement. So, first, some workers assume that their Social Security retirement benefit will be all or most of what they need in retirement. And second, most, if not all, workers assume that they will be able to draw a benefit on their spouse's record. So, regarding the first assumption, yes, Social Security was meant to be the foundation for building a comfortable retirement. However, on average, for average lifetime wage earners, that is, it replaces about 41% of the income they had while they were working. So a worker needs to have other forms of income in retirement, such as savings, investments, perhaps a pension from an employer, and build upon that Social Security to have a comfortable retirement. Regarding spousal benefits, much confusion about that as well. But basically, the way it works is that if you and your spouse were comparable lifetime wage earners, you will get what you're due on your record, and your spouse will get their benefit based upon their own work record, but you won't be able to get both. The exception might be if one spouse earned wages at a level of less than half of what the other spouse earned in their lifetime. So then there might be a potential there for the lower lifetime wage earner to draw um, their own Social Security benefit and then some on the higher lifetime wage earner. So, another thing I want to add is that if one spouse passes away, we do look for the potential of paying the widow or widower or survivor benefit. The benefit is intended for widows and widowers whose own Social Security benefit is less than about 100% of the deceased worker's benefit amount. So the percentage payable on the deceased worker's record can vary depending upon the age at which the benefit is taken. So, the other thing I want to add there is that only widows and widowers can choose to start taking a benefit either on their own record or on their deceased spouse's record, and then switch to the other benefit later on. Typically, that would be once that benefit grows to an amount that's higher than the one they're already taken. So there are very few exceptions to the legislation regarding when you can draw and so on and so forth, and how much you can draw. So when you take benefits, Social Security will basically look at all the potential benefit amounts that you're potentially eligible for, and you'll get the higher of the benefits possible going forward.
Got it. Okay. Well, callers are lining up as we speak, Maria. So let's go ahead and go to our first caller. And actually, you might have answered this question in some of your opening remarks, but I'll tell you what, we'll go to Florence anyway. And Florence, I'm about to put you in live. Florence is a retired teacher, and her husband paid into SSI. So hang on a second. Florence, are you there? Can you hear me?
Yes, I hear you.
Okay, Florence, why don't you go ahead and ask Maria your question about Social Security?
Okay, I didn't pay Social Security. I was a teacher. I paid retirement. But my husband works for Greyhound. He retired from Greyhound. And he paid Social Security and he paid in retirement. But my question is this: will I be able to get his Social Security when he passes? If he passes before me?
Well, unfortunately, Florence, the answer that I could give you in this venue is maybe, because Social Security would have to take into account, I believe you said you're going to draw a Social Security benefit.
No,
And
I
you're
told you.
also,
No, I told you. No, I didn't say that.
Florence is a
I
teacher.
retired from teaching. I paid
okay,
retirement. I didn't pay Social Security.
okay, just trying to clarify. So if you're going to
Mhm.
draw a pension where you did not pay into Social Security, we will have to consider two-thirds of that government pension to see if that is more or less of what you're due as a widow. If it's more than what you're due on your deceased spouse's record, you will not be able to draw on his record. Now, let me make clear that this is not unlike two spouses where there's only Social Security involvement. One would only be able to draw a widow's pension on their deceased spouse if their own Social Security is less than what they can draw on the deceased spouse. Now, Florence, if yours is less, if 2/3 of your government pension is less than what you're able to draw on your deceased spouse, you will be able to draw some on them. But keep in mind that those figures are going to have to be looked at. And also, we're going to have to look at your age when you want to take that pension to see if it is reduced because you're taking it prior to full retirement age.
Thank you very much, Maria. And Florence, I hope that answered your question. We're now going to go to Willie. Willie has a question about drawing Social Security from parish employment and wants to know if there's any possibility that the government will allow retirees like Willie to draw full SSI benefits. And I'll tell you what, we'll go ahead and go to Willie. Willie, go ahead and ask your question of Maria. Willie, you there?
Yes, ma'am. Oh, yes, sir. Sorry about that. I am drawing Social Security, but half of what I should be drawing because I'm drawing a pension from the local parish or county. So is there any chance of the government coming back and paying full Social Security that I earned and should be drawing?
Okay, so if I'm understanding, you're drawing a pension from, I believe you said the parish, in which
Yes,
you
ma'am.
didn't pay into Social Security, so you are drawing that.
And she had her 40 hours. We had our 40 hours in. Had the 40 hours in to draw Social Security. So drawing Social Security, half of what should be drawing, and then drawing from the pension from the parish. What I'm asking is there any chance of ever a chance of drawing the full Social Security like should be drawing?
Okay, so the reason why a person, when they receive a pension where they did not pay into Social Security, such as the state, city, or local government, meaning parish, when they draw that pension and they are also eligible to draw a Social Security check, they are absolutely going to receive the Social Security benefit check. However, it will be reduced a bit because they're also drawing that other pension. Now, when you're asking, is there the possibility that they will ever be able to draw the full amount? That would have to depend on a change in legislation. And that legislation was done back in 1983 or so when the windfall elimination provision was legislated. So it would require a change in legislation. And then we also don't know if it would be going forward or if it would be retroactive. So we just don't know. But that's the reason why the Social Security benefit is reduced due to that government pension.
Thank you, Maria. And for folks who have just joined our call, this is your chance to hear from and ask questions of Maria Alvarez, bilingual public affairs specialist for the Social Security Administration in Louisiana. And we're talking about the Social Security you've earned and the challenges facing this program long term. And again, this is an interactive call. So if you would like to ask a question at any time during the call, just press *3 on your telephone keypad, and you'll be connected with one of our AARP staff members who will screen your call. They'll take your name and your question, and they'll place you in our queue. So that means is the sooner you press *3, the sooner you can ask your question. All right, so before we go to our next question, we have a quick poll that is listed below, and that poll is asking, what is the minimum age for collecting Social Security? The choices are 1 for 62, 2 for 65, 3 don't know, and 4 is 4. So those are your choices. 1 for 62, 2 for 65, and 3 for don't know. So please enter your answer into the poll. And while we're doing that, we're going to go to Mary from DeRitter, who wants to speak with Maria to ask about her husband and how he can get supplemental insurance through Social Security. Mary, are you on the call? Mary, you there?
Yes, I am here.
Okay. All right, go ahead and ask your question of Maria Alvarez.
Well, Maria, we have been drawing Social Security since we were 75 and 65, and I am getting my supplemental insurance, and I'm not certain. My husband, he's standing right here by me here, whether he has it or not. He doesn't know for sure if he has that card. I had my card replaced, and I'm getting another one replaced, and it's on its way here now, I think. But I want to make sure that he is on it too, because we're having a draft drawn from the bank every month to keep that paid. And I want to make sure that he has got his covered. Can you look his name up?
I cannot do that during this live town hall for privacy reasons. We can't discuss that. But I believe you're talking about the Medicare and any additional insurance that you have regarding that. What I can recommend is that you contact the insurance, supplemental insurance provider, and check with them to see what it is, he has or doesn't have. Other than that, I think that contacting the local office would be another suggestion, but I do think since those private supplemental insurances or just that through private insurance companies, that should be your first attempt. And if you look on the card that you have, you will find a number for that insurance company, that private insurance company. I hope
Thank
that
you.
helps, Mary.
Okay, we're going to go now to Margaret, who wants to know, she retired a year before she could receive the full Social Security benefits, and she wants to know if she'll ever be able to withdraw full benefits. So Margaret, you are on with Maria. Go ahead, Margaret.
Okay, I was asking the question because the reason I retired before my I was gonna be 65 that next year, and the reason why I retired early, the year early, because they was closing the plant, and they was asking people that could retire to go ahead and leave. We didn't know what they was gonna do. Well,
I understand.
and so.
Oh,
So Margaret,
Go ahead. Answer Margaret's question.
yeah, Margaret, unfortunately, you will not be able to get that percentage that you were reduced back. When you take it early, it is a permanent reduction. But the good news is that I believe you said you took it a year early. So, although you were reduced, it wasn't a big reduction because you were only a year away. If you take it several years earlier, the bigger the reduction is. So I want to put your mind at ease, at least in relation to the fact that the reduction was probably not a lot since you were almost at your full retirement age.
That's helpful to know. So the closer you can get to that retirement age, the closer you get to a full benefit. But the good news is, if you're close, then it's almost like a prorated kind of thing.
Exactly.
All right. Well, that's good to know. Thank you, Margaret, for your question. We're now going to go to Sue, who wants to know how to apply for disability Social Security benefits. And Sue, you are on with Maria Alvarez. Go ahead, Sue.
Okay.
Hi, Sue.
I am getting Social Security, but it's not very much. And I apologize for my voice. I don't know where it went. But I just wanted to know if I could apply for disability. I've had so many things over the last 3 years, strokes and broken hips and many, many things. And I can't keep up with my expenses. I don't get very much in Social Security, and that's all I have.
I understand. I understand. When I'm assuming, so now you're receiving your own retirement benefit. And I can tell you that you're receiving the maximum possible because Social Security does not pay both retirement and disability. But the good news is that the retirement amount you're getting would be equivalent to the disability benefit you're getting for the most that you might have gotten, but you only get one, not both. So, for example, a person that opposite of you, if they were receiving disability and they reach their full retirement age, nothing changes because the amount of the disability benefit is pretty much what they would have received at full retirement age anyway. Now, what I do suggest, you did mention that you're having trouble meeting your expenses. There are a number of resources in the community that might be able to help you with that. What I recommend is that you contact your parish council on aging, and they may be able to refer you to some organizations in your area that may perhaps be able to assist you in another form. So I hope that helps, Mary. I'm sorry,
Thank
Sue.
you, Maria. Yeah, that was Sue. Maria,
Yes.
what other resources or what other numbers, if somebody doesn't have, well, there's a council on aging in pretty much every parish, but if somebody
Correct.
has trouble reaching out to their particular council, what would be their next course of action or their next option?
Honestly, Andrew, I think just to do their best to get in touch with the Council on Aging, because those councils on aging are an independent source of referrals they can help, depending upon the person's needs. They can help with things such as, in certain situations, for example, helping with finding, sources to pay for their medication. They have a program called Senior RX that assists with that. I'm not saying that they will definitely be able to help, because each situation is different and the eligibility criteria for these programs are all different. But they can basically make referrals or help the individual to find resources which are unique to their community, and help, help with rental assistance, help with perhaps utility bills. Each community has different organizations that might be able to help with that. Sometimes churches are able to help with that, depending upon, the community in which you live. But like I said, those councils on aging are well informed about those resources available. And since they work in a particular parish in which the individual lives, they have a good idea of which direction to point the individual in for additional assistance.
Perfect. Okay. Thank you. And for folks who are just joining, again, this is your chance to hear from and ask questions of Maria Alvarez. She is the Public Affairs Specialist for the Social Security Administration here in Louisiana. And we're talking Social Security, the challenges that are with Social Security, and answering any questions you may have. So we're going to go now to Catherine. Her full retirement age is 66. She works at a non-governmental company and wants to know how that will affect her benefits when she applies in a few months. So, Catherine, can you hear me? And you can go ahead and ask your question of Maria.
Can you hear me?
We got you.
Okay.
We can hear you. Hi, Catherine.
Hi. I reached full retirement age in December of this year. I'm 66 in 4 months. I work for a non-governmental company. Although I haven't applied for my retirement for them, I plan on applying, and I wanted to know how that will affect my Social Security payment when I do file for Social Security.
Okay, Catherine, if you work for a private company where you pay into Social Security,
Yes.
if you draw a pension from that company, it will have no effect on your Social Security benefit because you've paid into Social Security through that employer.
Okay.
So no effect. The only time that the Social Security benefit might be affected is if you're going to draw a pension from an employer where you did not pay into Social Security. And that's not your case from what I hear.
Thank you, Maria. Just out of curiosity, what is the full retirement age, and maybe even a Part B? What is the maximum Social Security retirement benefit that is payable? I guess that's really two questions, but
Yeah, there is an amount that's capped, Andrew, as far as contributions into Social Security. This year, it happens to be a little over 160,000 a year. So if you pay into Social Security at that salary level, you're basically maximizing your benefit check. But keep in mind that depending upon the age at which you take the benefit amount, it could reduce it. But to answer your question, If you've paid in your whole lifetime at that maximum amount, you would draw out a nice benefit amount. Like I said, depending upon when you choose to take it, it could be upwards of $3,000, perhaps more. But I would say an average Social Security check might be about $1,800 or so. But like I said, unfortunately, there's no clear answer to that because depending upon when you take it would affect the amount.
Thank you for that. All right, we're going to go to Wayne. He and his wife are drawing Social Security benefits. They have TRICARE for their life insurance, but he would like to know what other options are available. So I tell you what, Wayne, we have you on with Maria. Can you go ahead and restate your question for Maria, please? Thank you.
Yes, hello, Maria, and thank you
Hello,
for
Andrew.
this. This is about the 34th one I've listened in on, and they've all been very helpful. My question is, I am 72, and my wife is 69 this year. We both have been drawing Social Security since 65, and my question is, with all of the supplements, we get confused when we watch all the commercials. We have Medicare, and we also have TRICARE for life from our military service. So we feel pretty adequately. We're very adequately taken care of that way. But we keep watching all this stuff on TV, and I'm thinking, am I missing anything? But I believe most all of that stuff comes from the supplements. Is that correct? And you pay in for the supplement.
Well, Andrew, I can tell you that that's an in-depth Medicare question, but if you have TRICARE for life along with Medicare, yes, you do have very full coverage.
Yes.
The Advantage plans are private plans that within those plans have like the gold, silver, platinum levels, but you're tied into a network, which isn't necessarily a bad thing because the doctors, hospitals, and clinics you go to already may be covered under those plans. But it's all a matter of the form that works best for you. If you are happy with your TRICARE and Medicare, that is pretty comprehensive coverage. But if you're curious, I once again will mention the Council on Aging in your parish for them to perhaps take a look at what you now receive and what's available. Once again, those plans may change on a yearly basis. So that's why there are open enrollments each year that allow people to change plans or start a plan, etc. But the councils on aging in your parish have a department that is called SHIP. It stands for Senior Health Insurance Information Programs, and they can compare what you have to the plans available and basically just show you what your options are. They may very well just say, hey, with TRICARE and Medicare, you're doing well. You're probably not going to get a better plan than that. Or they might say, well, here's a plan that is comparable cost-wise, and here's what they offer. But the one thing I can tell you is that those plans will tie you into a network where they have certain hospitals, doctors, and clinics. You can go out of network, but then you would have to pay. but not being a Medicare representative, I would say that your best bet, if you are wondering if you're missing out on anything, is to contact them, and they will be glad to compare what you have to anything else that might be available to you.
Thank you, Maria. And we have several hundred listeners on the call right now, but keep in mind this is an interactive forum. So if you'd like to ask a question at any time during this call, just press *3 on your telephone keypad and we will get you connected with Maria, who is here to answer your question for the next few minutes. So we're running low on time. So if you want to ask a question, now is the time to do it. Again, press *3. Sooner you get your question in, the sooner you'll be online with our special guest, who again is Maria Alvarez, the public affairs specialist for the Social Security Administration. We have a couple other questions that we can go to right now. We have Erin, who wants to know, she's divorced and she wants to know if her ex-spouse files for benefits before her, will she still be able to receive his benefits? Maria, you there? Or excuse
I
me,
am
Erin, you
here,
there?
Andrew.
Maria, Erin, you there? Let's
Hello?
see, you mean Erin, you there? Yeah, Erin, go ahead and
Yes,
ask
I'm
the
here.
question of Maria.
Hello, Maria.
Hi, Erin. How are you?
I'm okay. I would like to know if my husband passed, because we are divorced 10 years now, and if he passed before me, if I would get part of that Social Security.
Okay, the first thing I would need to ask you is how long were you all married? Over 10 years?
I think we just lost Erin. Go ahead and
Uh-oh,
go ahead and break it down for us. Give us all the
I
different
will.
categories.
Okay, so if Erin was married to her divorced spouse for 10 years or more, there's potential eligibility. However, just like when we talked about eligibility on your spouse's record, most of that applies the same way, meaning that you only have ability to draw on their record if yours is less than half of theirs. So basically, only if she and her divorced spouse were very different, in other words, had earnings at very different levels. If she was perhaps a lower lifetime wage earner and he was a higher lifetime wage earner, then she might be able to draw some on his record. But if her benefit amount is is half or more than his, she would not be able to draw on him. The other thing for divorced spouses is um, if she remarried and is currently married, um, they would have to look at that current spouse. She was technically a dependent of the current spouse, but I'm assuming in answering her question that she did not remarry, certainly not before age 60. So she would have potential entitlement, but what would need to be looked at once again is her benefit amount and his benefit amount. And if hers is less than half of his, then maybe. And then once again, we have to look to see if Social Security is her only income. I'm assuming that she did not work and earn a pension from a government organization, etc., like we discussed. Um, but roughly speaking, that's how that would work.
Okay, Erin, I hope that clears it up a little bit. Gloria wants to know, this sounds like a very frustrating situation. Gloria received a letter from SSI explaining that they made a mistake on her benefit amount, uh, and they changed her benefit amount and wants to know how that's possible. So I'll tell you what, Gloria, if you are there, go ahead and ask your question of Maria Alvarez. Thank you, Gloria.
All right. Okay, my name is Gloria A. Wilk, and I receive Social Security benefits on my own, not on a late husband, because mine was more, so I chose mine. To make a long story a little shorter, I received this letter that stated that they changed my monthly benefit to $890.70 as of January 2023. And they said they found that the prior amount was incorrect. So they changed the benefit amount to give me credit for 2023 earnings, the year 2023 earnings. They did not include these earnings when they figured the benefit amount before. Then they're saying what we will pay and when. We pay Social Security benefits for a given month in the next month. I got that. For example, benefits for March are paid in April. I understand that. Then they're saying in this letter that I will receive $725 for October around November the 3rd. Well, I'm wondering what happened to the benefits that they made a mistake in for a whole year.
Gloria, unfortunately, that's something that you will have to discuss with the local office, because they're going to have to look at your record. I do not have access to your record, and we could not discuss that on the air anyway. But contact your local office. I can also give you our customer service number if you'd like. That number is 1-800 772 1213. Once again, 1-800 772 1213. And they will be able to pull up your record and give you some answers, because honestly, I don't know without having a record in front of me.
And how would she contact her local office? What would be the best way to do that?
Yes, if two ways. You can go on our website and search for office locator, and by zip code, it will give you that information. But also, if you call that 1-800 number, they could either help you, or you can ask them for the local office number as well.
Okay, so the customer service line is almost like a clearinghouse for everything. It'll get you your local office, and it'll also help answer any questions. Once again, that customer service number, for those who might have missed it, is 1-800 772 1213. 772 1213. Okay, and they can pull up records, give answers, and they can also do office searches, and I'm sure a variety of other things. So thank you, Maria, for sharing that. We have a couple more questions. We have a few more questions. So let's go ahead and start doing these rapid fire style, because I want to make sure we get to everybody. We have Keith, and he wants to know, he receives disability retirement benefits, turning 65 next year, and wants to know if he can receive disability Social Security benefits. Keith, real quickly, we're running low on time, so go ahead and state your question, if there's anything you want to add to what I just said.
That's basically my question, and I wanted to know if I'm eligible for Social Security disability, or how does that work?
Okay, so are you getting benefits right now, Keith, just to clarify?
No.
You're not. Okay. So you can file, Do you mind telling me the year that you were born? I'm trying to determine what your full retirement age is.
59.
Okay. So your full retirement age would be 66 and 10 months. You can go ahead and file either for, actually, what the office will do is perhaps file a claim for you for disability. And if you would like, they could also file for you for early retirement. They could start paying you your early retirement. Of course, that has a little reduction because you're prior to full retirement age. However, if you're approved for disability, then they would switch you to the disability amount, which is equivalent to what you would have received at full retirement age. But yes, you can file for disability.
Okay, that answers.
Okay. All right. Thank you, Keith.
Okay.
Again, this is lightning round. So if you want to get in your question to Maria, now is the time to do it. Hit *3 on your keypad. And we have just a few more minutes with Maria. So now is the time to ask your question. We have Rosa, who wants to know, she's retired and her husband passed away earlier this year. She applied for his benefits and she wants to know how much longer it'll be before she hears from them. Rosa, you there?
Yes.
Hi,
Did I get your
Rosa.
question right? Is that it?
How long ago
Go ahead,
did you
Rosa.
file for the benefit, Miss Rosa?
Uh-oh. She
We lost
might. I
her.
think she might have hung up. She said
Okay,
her husband passed away in May, so I don't
okay,
know.
okay. So that's been a little while. I would say that if he passed away in May and she filed a claim for to see if she's eligible for his benefits, etc. There's also a lump sum death benefit that might be payable to her if they were living together upon his death. Miss Rosa would need to contact her local office or that 1-800 number, Andrew, that we just mentioned, to follow up on that claim because it's certainly been long enough for her to have received a decision.
Got it. Okay. All right. Well, we have Carol, who is our final question in the queue, and at least final question as of right now. Her question is, how much savings, in other words, stocks, bonds, and those kinds of things, can you have while on Social Security? So, Maria, can you give us a quick? Oh, I'll tell you what first. Carol, do you have anything to add to that question? Is that your question?
No, that's fine right there.
Okay.
Okay, so with Social Security, meaning retirement or disability, because you've worked and paid in to Social Security, it doesn't matter what you have in savings, investments, anything of that nature. The only time that's looked at is if you're receiving a different benefit from Social Security called Supplemental Security Income, or SSI for short. That's another program that's run by Social Security. It's funded differently because it's an assistance program. And that's the program where we would have to look at income and resources to see if the person qualifies. But if you're receiving benefits where you've worked and paid in, there's no limit on other income or resources.
Okay. All right. I'm going to rattle off these resources one more time. We have the Social Security customer service office, which is 1-800-772-1213. We have the office locator, which is ssa.gov/locator. You can get your information that way, and you can also, of course, ask the customer service number if you want to go about it through the 800, the toll-free 800 number. We are now wrapping up. Before we go, though, Maria, is there anything else that you would like to quickly add before we adjourn the call?
There certainly is, Andrew. Thank you for that opportunity. There is an account on our website that we call the My Social Security account that I recommend that anyone, whether they're already receiving benefits or not yet receiving benefits, that they create their My Social Security account on our website. The information
Anybody can do that? Anybody can do that?
Anyone 18 years of age or older can do that. So that is the equivalent of the paper benefit statement that we used to send out on a yearly basis to everyone, whoever paid into Social Security. Now we only send the paper statement when folks are getting closer to age 60. But other than that, you can create the account, look at your information. We recommend that, like we said, Andrew, everyone who's paid into Social Security create their account, check their Social Security earnings history to make sure all their earnings throughout their working years are posted accurately. Because remember, that's what's going to determine the benefit amount in the future. If you see any type of discrepancy, meaning that you're missing earnings in any particular year, a dollar here or there is not going to make much of a difference. But if you worked in a year, paid into Social Security, and you don't see any earnings posted, you do need to let us know so that we can try and help you recover that information so that you get credit for those earnings. And the other thing the Social Security account, the My Social Security account will let you do is, for example, request a duplicate Social Security card. Once you're receiving benefits, you can basically transact any business that you need to transact with Social Security through that account, such as changes of address, phone number, changes in direct deposit, starting direct deposit. All of those transactions can be easily done safely and securely on our website with a My Social Security account. So I want to invite everyone to create that account. And just another reminder is that you can file for your retirement benefits and even for Medicare online on our website. It's still reviewed by a human pair of eyes, so you don't have to worry about that. You're just choosing to submit your application to us through our website instead of, over the phone, etc. So I also invite you to consider that when you're ready to file for your benefits. Thank you, Andrew, for the opportunity, and I want to thank AARP Louisiana again.
Fantastic. All right. One more time, I'm going to rattle off all these different resources. So if you want to call the customer service number, it's 1-800-772-1213. If you want to look for your local office, it's ssa.gov/locator. If you want to create your My Social Security account, it's ssa.gov/myaccount. And those are the resources we have today. So again, AARP wants to thank Maria Alvarez, the bilingual public affairs specialist for the Social Security Administration in Louisiana. Thank you, Maria. We apologize if we were not able to answer your question, but I do believe we were able to get to everybody today. So it's always nice when we can do that. But if you do want to stay on the line, you will be able to leave us a voicemail with your question or comment. You can also obtain valuable information from our own Social Security Resource Center, which you can access at aarp.org/youearnedit. Or you can call us here in Louisiana by going to your phone and dialing 1-866-448 3620. Again, that's 1-866-448-3620. Thank you again, Maria, and thank you to all of our participants today. Have a great day.